Guided personalized surgery with Advita GPS is the latest advancement in technology that provides surgeons with real-time visual guidance in total shoulder replacement surgery. This advanced platform combines surgeon expertise with a computer system to perform your shoulder surgery with a goal of advanced accuracy and precision personalized to your unique anatomy. Prior to the operation, your surgeon will use a preoperative planning tool to plan your surgery through a virtual simulation. Your surgeon can then execute the plan in real time during the surgery based on a 3D anatomical model of your shoulder, making adjustments as needed. With a tracker placed on the patient's bone, the system sends data on each patient's anatomical structure and joint movement to the computer. This active tracker technology works together with an infrared camera to monitor the position and alignment of the joint replacement. The computer analyzes the data alongside the 3D model of your bone with calculated key measurements. The surgeon can see important parts of the shoulder anatomy on the display screen that are normally difficult to view during surgery. With this comprehensive visual, your surgeon can verify precisely where to remove damaged bone and place the implant personalized for your unique bone structure and anatomy. Advita AI surgical technologies help surgeons make precise and personalized decisions during surgery. For more information about GPS and our AI technologies, visit www.advita.com/patients.